Thank you for listening to Depictions Media Radio.
Et chef de la direction de recherche en politique publique. I'm the president and CEO of the Institute for Research on Public Policy. I'm very happy to be here for a second day and continue our conversation about les accords en matière de santé, les accords canadiens en matière de santé. Now what? We had a great discussion yesterday, kicking off with our friend Shachi Curl, who's here again, I think somewhere in the audience, talking about the survey, the very interesting survey she did of Canadians and their perceptions of the healthcare system. Some very interesting things to draw from that, including that Canadians are very dissatisfied with provincial, territorial, and federal levels of government in terms of what they're seeing in the healthcare system, that they understand that money isn't going to achieve the system level change that the system needs. Shachi talked about Canadians starting to be more curious, which was very interesting as well. And I know you had a discussion this morning about private versus public health care. So we have, and we also had a very interesting conversation, you'll recall, with CMA presidents past and present, and their perceptions of what were the priority areas that would really get the system to that sort of architectural change that's required. And we have Dr. Ross here again, the incoming, newly inaugurated president of the CMA with us, and another special guest is the newly appointed Minister of Health, the Honourable Mark Holland. So I'm going to get right into it. Thank you. Minister, the portfolio isn't completely foreign to you. You were an executive at the Canadian Heart and Stroke Association. You also were you were also in the House when the government was steering the budget with all the new funding for healthcare. Can you tell us what your priorities are for the portfolio in the first 60 days?
Well, in the next 60 days, first of all, thanks for the opportunity to be here. And just let me say, I'm a veteran in the role compared to Kathleen. You're 2 days, I'm 2 weeks. So we're both very new. But no, it's a tremendous privilege to be here. Look, the next 60 days are going to be really critical. There's a bunch of things that are happening. We had the announcement last February, a historic announcement of $200 billion that's going to be put into the health system, but people want to see the bilateral agreements. They want to see the details and the action plans of how that money is actually going to have an impact in improving patient outcomes, and be able to see what are the metrics. And I want to thank the CMA, which has been really critical in pushing to say we have to have those metrics to show empirically how those improvements are occurring. So we're going to be rolling a lot of those out over the next 60 days. In Charlottetown, we have the Ministers of Health meeting that's going to be taking place. I've had an opportunity in the last 2 weeks to meet with all of my provincial and territorial colleagues, and so getting those agreements signed is huge. Getting them not just signed but understood, so people can really see how that money is going to live and change the health system. Secondly, the progress that we're making on dental care. We're going to have a lot of announcements around. We've had enormous success with the program, which is effectively a rebate type program right now, but we're getting ready to launch a national dental care program that will be available for about 9 million Canadians. So this is extremely significant. And then we have legislation on pharmacare. But overarching all of that, Jennifer, I think is building a sense of momentum, building a sense of optimism, that, you know, as tough as those numbers that we saw from Angus Reid and Saatchi yesterday, and as much as we have to acknowledge that that's where people are and what they see, that there's great room and space for optimism. And in the next 60 days, I want to start to have people feel that.
I'm going to come back to the question of momentum in a moment, but Dr. Ross, what are your priorities or your wish list as a minister in the next 60 days or so? I mean, I'm throwing that out as an arbitrary.
Well, I'm going to copy you for a second, because the next 60 days are really important, and there's a lot happening. What we heard in our survey and what we've been hearing from patient representatives here and the people that are providing the services is that access to care is a priority. The survey really highlighted for us 4 out of 10 Canadians are chronically having trouble finding care, and half of Canadians are struggling to seek primary care. This has got to be a priority, the bedrock of our services. So understanding and prioritizing that has got to be out of the gate what we want to look for. And you're right, the CMA did put a lot of metrics in place, but underlying all of that is access. And accountability is the other piece. And I think we really want to have an easily understood, publicly available, benchmark-based way of assessing are our dollars going where we need them to go, and are we seeing the impact at the ground level, at the provider and patient interface? Are we seeing them?
Can we pull on that a little bit in terms of the benchmarking and the measurement? What can the federal, and I'm asking both of you, what can the federal government do to oversee the benchmarking? Because the provinces are all going to come with their different conceptions of whether they're making progress. And that's often been the challenge in the system, right? One province says they're doing this, one province says they're doing that, and you never have a kind of standard conception of what's happening. So whose job is it to evaluate and set a standard for, yes, we're making progress in all these different areas, whether it's, you know, team-based care, pan-Canadian licensure, wait times, Dr. Ross and
So my opinion is that it's everyone's responsibility. I think that we've seen unprecedented collaboration between medical associations, other professional organizations that give care, and now we're seeing more collaboration between provinces, territories, and the federal government. Missing in the middle is the way that we track and report data. So we need a standardized process that we can track data. All of us are very open about it and be able to say, okay, here's how we're going to collect it, here's where we started, here's what we did, and here's where we saw some improvement, and really openly admit when we do something and we fall flat on our face. We have to be building a culture where that's okay. That's an innovation. We tried it. It didn't work. Let's move on to the next thing. What did we learn from that?
Yeah, I mean, I completely agree with Dr. Ross around defining what failure is. And we just had a quick opportunity to talk about that. Because we need to engage in transformative change on a scale that we've never attempted before. Mm-hmm. And that's going to require a bunch of different things. Yes, absolutely, making sure that there's harmonized metrics so that empirically in data, people can see that improvement happening. But it also means that provinces, health systems, hospitals, doctors, nurses, innovation has to be allowed. And the only way innovation will happen is if we change how we define failure. And for me, trying something that's rooted in evidence and evaluation that doesn't work out is learning. It's not failure. And so we have to give space for one another for that kind of spirit to pervade what we do. And I really want to thank the CMA because they put, you know, a real focus on lived experience and on the experience of patients. And it's important as we're talking about this monitoring and we're having a harmonization of those data metrics, that at the same time that the lived experience of a patient is improving. You know, it's essential that people feel that improvement because it's, you know, there is, and you're seeing that in the numbers that you're talking about, a lot of people who are losing hope, losing that sense that things are going to get better. So they have to feel it. The numbers alone, as much as they're essential, and they have to be visible, and you need to be able to look from province to province to see how money is being spent and how that's actually having an impact on health, we need to ensure that folks are feeling that on the ground as well.
So I think it's fair to say probably there's people in this room, people that work in the, broadly speaking, the policy sector, like myself, there's skepticism around the money being out there and whether it's actually going to be spent the way that it should be, or that there will actually be constructive change. How would you hold the provinces to account in the long term for living up to their agreements?
Well, I'll start, and we had a great conversation, a bit of a roundtable to start my time here. Tim Green, who's the head of the Canadian Nurses Association, said something I think is really powerful, which is that Canadians are not going to let us get it wrong. You know, I think that one of the biggest points of accountability, particularly when these metrics are in place, is that Canadians are done with turf. They're done with politics. They're done with excuses around jurisdiction. They want to see results. And I think that what I can say, what is so encouraging to me, is that is understood. I think viscerally. You know, I've had really good, some in person, some virtual, but I've had an opportunity to talk with all of my territorial and provincial counterparts, and they are on the same page. You know, we talk about taking a team approach to healthcare being the best way to tackle the challenges that are in front of us. You know, Canadians don't expect, they demand that governments take the exact same approach. And so we have to be singularly focused on that. And I think, you know, we have to start with the goodwill, the words that are being said. I mean, that's going to be demonstrated in evidence. And there will be some provinces that will be leaders. And I think that we celebrate that success. We advocate for those successes to be replicated elsewhere. We recognize these numbers, the evaluation, that feeling of momentum. I think that Canadians, where they see it happening in certain jurisdictions, will demand it in others. There will be leaders, and there will be others that are falling behind. But I'm very convinced that that spirit and the demand that's coming from Canadians is going to ensure accountability along with the data.
Dr. Ross, what do you think could be done by other actors to encourage the provinces and territories to be accountable to their promises, to fulfill some of the elements that are going to be contained in these agreements?
So it's a great question, and as I said, my opinion is that it's everybody's responsibility. We're all of us citizens. We heard this morning in our discussions about the balance between private and public, that it really is a value. Our Canadian healthcare system is a core value to Canadians, and we all have a responsibility in doing this. How do you do that? If you are a patient, you can talk to your care provider. If you are just a citizen not currently engaged in the health system, where we will all be, then talk to your political leaders. We can certainly keep asking those hard questions, and we need to keep asking those hard questions and digging deep when we're not getting the answers that we need. And instead of covering and hiding where things aren't working, you should be showcasing that, going, okay, what can we do about this? Right?
What are some of the priority areas, Dr. Ross, that you'd like to see the provinces and territories focus on?
So last month, the CMA released a fairly comprehensive list of what we would, think is attainable. And I was asked in an interview, oh, this is a great list, but do you think it's actually doable? Yes, I do. I have a tremendous amount of optimism. I think the time is now. 60 days is a bit of a tight timeline, but I think that the time is now, and we're on the precipice of reforming how we deliver care, and you can even say how we're defining care, including those things in the basket as we heard this morning: dental care, pharma care, physiotherapy, physical therapy, if it's needed in home care critically. We need to look at all of those things. But our targets were not rocket science, if you put it that way. Eliminating all the emergency room closures in the next 3 years, ensuring that people have access to a family health team or primary care team. 90% of Canadians in 5 years, 95% in 10 years. This isn't untenable. Looking at having our surgical backlog cleared to the point that we're meeting benchmarks that were established back in the 2000s. We're not asking for the moon and the stars here, simply looking at what is reasonable for Canadians to expect from their care.
Thank you. So, Minister, you were talking about momentum, which is encouraging, I think, the people in the room and others that are working in this general sector, because there's a feeling that maybe once the money is out the door and the big announcements are made, that the attention sort of drifts. because the ensuing work is not as glamorous. There's an election that's sometime in the offing in the next 18 months or so. How can we be certain that the attention is not going to drift to all the other myriad challenges that the government's going to face? I mean, thinking about just today and the catastrophic fires that are burning in BC and the Northwest Territories, is it possible that this will just become a lower priority item in the next 4, 5, 6 months?
Yeah, I think so. Going back to the roundtable discussion we had, and Dr. Sharp, who was the past president, said this is too important to fail. And yes, there's going to be a lot of things that pull our attention in other places, and have to. You know, I had a conversation with somebody just at lunch who was talking about, you know, their family and friends not being able to leave the Northwest Territories right now. You know, and that evacuation that's occurring, the devastation that's happening there, the fact that some folks are going to come back and not have a home, you know, that how could you not be gripped by that? But everything comes back to health. You know, when we talk about economic portfolios, as an example, health isn't really tossed in the mix. But how do you innovate? How do you have a productive workforce if that workforce has serious mental health challenges and physical health challenges? How do you deal with the existential threat of climate change if we're not healthy to meet that threat? And frankly, how does health play into that? You know, that a declining planet with worse air and extreme weather events is going to have incredibly injurious effects on our healthcare system. You know, in Northwest Territories today, what are we doing with the folks who, you know, have been evacuated and can't go to healthcare providers in their home jurisdiction? So in every single facet, you know, I'll take my time. I was a critic for public safety and national security. I visited every federal penitentiary in the country. 80% of inmates have addiction issues. Addiction issues are fundamentally a health problem. Mm-hmm. So it doesn't matter what line you draw where, health is at the center of it. So if we don't deal with health, if we don't tackle the crisis that we have with mental health and primary care, and ensuring that we reduce backlogs and improve patient outcomes, then those other problems aren't going to repair themselves either. So for me, it's a very clear and easy guiding star. The last point I would make, I think, and we had this conversation as well about the pandemic, and that I think, you know, the entire country, entire world was focused on health and healthcare in a way that it really never had been before. And I still think there's a lot of momentum to that attention.
I find that interesting because we've heard many stories about, you know, how the premiers met weekly or more frequently, that coming together during COVID, but also hearing about snapping back to old habits. And when people are scrambling to just keep an ER open or put Band-Aids on things so they can just keep the system afloat, their first priority might not be data sharing. Their first priority might not be, let's get the foreign credentials issue sorted out. So that's where I'm just interested in how you're going to keep that focused attention on the items that are not where Canadians' first mind goes to. And Shachi's survey pointed to, for example, the number one thing being able to access an ER, where access to primary care is probably one of the key issues that, for example, the association's interested in. So it's a long-winded question, but is it possible to keep the province and territories and the federal government focused on the items that are not, I guess, as urgent and are more architectural in nature?
Yeah, I mean, it's a great question, and I think the answer is, you know, I think I play a really important role in being on the road all the time. You know, in my first 2 weeks, I've been in British Columbia, I've been in PEI, I'm obviously here in Ottawa, I'm in the GTA, and we're planning to have me on the road all the time to continue these conversations face to face, to meet with the stakeholders, the patients, the healthcare providers, the doctors, the nurses, with everybody to hear their lived experience directly, and so that I can advocate and be their voice in that, and to keep it real and keep it alive. I think what happens is, you know, and I was the whip for over 3 years, so the chief government whip is responsible for holding people to Ottawa. Well, as the whip and the House Leader, I was in Ottawa all the time for 5 years. My role here is to be on the road all the time, and to be right in the trenches, seeing it, feeling it, and having those conversations directly, face to face, with my counterparts, and to keep that pressure on. And I think what is really great about the launching of these action plans and the bilateral agreements is that because we're going to have that harmonization of metrics, we can see what's moving and what's not. Canadians can see it in the data. We can lean into that, and there's the opportunity to see, and having those experiences, what innovations are working, what might be applied to other parts of the country, and yes, what isn't working, right? I mean, that is the whole spirit of the Enlightenment, which is I was talking about earlier. And somewhere along the line, we've lost the spirit of the Enlightenment. There's nothing wrong with admitting something isn't working, right? To say we can't do this anymore, or that we tried something and that it failed. That's where learning comes from.
So what would success look like for you?
Well, success for me is very simple. You know, if you look at what Sachi presented from Angus Reid, we have to turn the tide. We have to have people have optimism and hope in our health system. We have to have them feel and see in numbers, see in data, see in evaluation that improvement is happening. But we have to have them feel that as well. And you know, one of the things we talked about that I think is really important to me, and in my closing remarks I'll touch upon it, is that direction. You know, there was a nurse in PEI who is in a rural setting, you know, really on her own, holding up the world and doing work that is, you know, it's just hard to listen to because how much she's holding up. But she's not asking for the system to be reformed and changed overnight. I don't think Canadians are either. What they're asking for is, what, in her words, a light at the end of the tunnel. Show me where we're going. Show me it's getting better. I think that, you know, the enemy here is a feeling that things are getting worse.
Mm-hmm. Which your political opponents are playing up on, right? Which I'm sure will be an issue that arises in the next 18 months. Dr. Ross, do you have an idea of what you think success will look for the government in the next while?
That's on the light at the end of the tunnel, and I can't remember who said it to me yesterday, but it was absolutely brilliant. But the saying was, due to budget cuts, the light at the end of the tunnel has been extinguished for the time being. And that's a little bit how it's felt for the last more than 2 decades that I've been working in health. So what would success look like? Success for me would look at my ability to deliver care at a grassroots level, where I can say to a patient, you need this medication, you need this investigation, you need this treatment, you need this referral, and it's all going to happen within the foreseeable future. Success to me is not going to have that young breast cancer patient that wound up dying because we couldn't get her investigations done, we couldn't get her treatment done. It's going to look at not losing one of my best friends a year ago because she couldn't afford the chemotherapy that wasn't covered. It's going to look at keeping the elderly patients where they want to be at home with their supports wrapped around them and not in the long-term care. So these are all personal stories that say, okay, we've gotten there. Now, I completely agree with you, and we've talked about this. One of my new favorite quotes is by Thomas Homer Dixon, that people who are in despair are not going to get up and solve your problems. And I think we have to come at it with that sense of optimism, and that something is going to change. But at the same time, when you have a high percentage of Canadians that are so pessimistic that anything's going to change in 2 years, and slightly lower, but maybe it's going to change in 5 years, we need to keep speaking from the heart about the stories, about how that actually influences things. And the timeline, if you look, and it's absolutely critical that we look at this beyond the next political cycle. The metrics that we put in place, that we proposed, trying to inform the action plans as they come out, it's not, okay, by next election cycle we want to have this. It's in 5 years we want you to set this, in 10 years we want to set this. And we need to try and uncouple those long-term reformative innovations from the political cycle.
Minister, we're just about at time, but I wanted to ask you about pharmacare because you raised it. And obviously there's a lot of political implications to that plan. It's part of the agreement that the government has with the NDP, that there be some kind of plan before the end of the year. Could you fill us in on where that's at?
For sure. Well, what I can say at the highest level is I'm not going to give you as much detail as you want because those conversations are ongoing. But I will say we are committed to introducing legislation in the fall very soon, and that I had a great conversation with both Don Davies and Peter Julian. I'm looking forward to having a conversation in the very near term with my counterparts in the Bloc and in the Conservatives. But I can say, I just came from PEI, where we had an announcement on the remarkable success of the collaboration on pharmacare that we have in PEI, where 60 drugs were added to the formulary. We're able to bring the copay for 60% of the drugs folks are using down to $5. It's resulted for Islanders just since June in $675,000 in savings. And I think that's a really good example of how collaboration between the federal government and the province is going to lead to really great results. Now, we've also taken action with new regulations on patented drugs that are going to make a big difference. We have $1.5 billion that has been put into the rare disease strategy that's there for drugs. So we're doing a lot of things in the pharmacare realm, and I know that everybody's looking forward to that legislation that will set some of the framework. But as I can tell you from my time as the leader of the government of the House of Commons, those are dynamic conversations that are moving, and so I wouldn't want to be prejudicial to them.
And on dental care, just as the last question, can you fill us in a little bit on where that's at? I know that there's been a lot more movement on that than pharmacare in recent months, but.
Yeah, sure. I mean, I really want to thank the folks at Dr. Stephen Lucas is here, who's the deputy with Health Canada. His team at Health Canada has really made miracles happen in many ways for us to be as far along as we are. The plan that we have right now, which rebates Canadians for children under 12, has helped over 340,000 children in the first iteration. In the second wave, just in the last couple of months, we've seen over 100,000 help, and we're gearing up for the national plan. As I mentioned earlier, that's going to be impacting around 9 million Canadians. And this is not only a commitment that we made in the supply and confidence agreement, but when I hear things, when I'm talking to folks, and you hear that the number 2 cause for children being in a hospital for a surgery is oral health, and almost all of that is preventable. There are huge consequences for prevention and taking action on dental. And and it's one of the things that I see we don't have a lot of time left, but I'll say it's one of the things that we need to think about generally. That a lot of times when we think of the advancements that we've made in the Canada Child Benefit and how that's vastly reduced poverty, over 2 million less people in poverty, hundreds of thousands of less children in poverty. That the socioeconomic benefits of that to the health system are enormous. So when you talk about cuts and you talk about, you have to think about the impact of the other actions we're taking to reduce poverty, to take action on dental care, to take action in the preventative space, to ensure that we reduce costs upstream and avoid the costs in the system as well.
Thank you, Minister Holland, and thank you, Dr. Ross, and thank you to you all for attention.
I'm Minister Bill Blair, Minister of Defence. We've just concluded an incident response group meeting that was convened by the Prime Minister. We heard from Minister St-Onge, who has remained in British Columbia to assist and support the ongoing response efforts in central BC with respect to the wildfires, as well as the Northwest Territories. We also heard from Chief of Defence Staff and the Deputy Minister of Public Safety with respect to all of the activities that are taking place in the province. We got an update on the current fire situation as it exists in Northwest Territories, and although the situation there remains quite concerning, I would characterize it perhaps as beginning to stabilize. There are currently close to 450 Canadian Armed Forces members still deployed into the region, assisting with logistics, fire mop-up, firefighting, and some airlift capabilities to make sure that we were available there. And in addition, there's been additional deployments and services being supported to British Columbia. And for example, as the Prime Minister has already mentioned, we have approved the use of the Vernon military cadet camp for the staging of firefighters and the receiving evacuees. And so far, no one has attended that facility, but we did reach out very proactively at the time, at the earliest part of the weekend, to British Columbia, saying we would make that facility available. Additionally, the Chief of Defence Staff shared with us that he has already deployed about 38 Canadian Armed Forces members into British Columbia. They're doing reconnaissance, but they've also, we are provisioning for airlift services at the present time. British Columbia has not requested those services, but we want to make sure that they are available, that British Columbia knows that they'll be available to them. Additionally, we've deployed Canadian Armed Forces members into all of the emergency management offices, both provincial and regional, to ensure that they're aware of Canadian Armed Forces capabilities and to ensure that when and if those resources are required, that we make them available. The Prime Minister has been very clear to all of us that we will lean in and do everything that is necessary to support people. First of all, our first responsibility always is to keep people safe, and that work is our greatest priority. We know that there are some long-term things that we are going to have to do in order to help those communities that have been impacted recovering, but we're also starting to think very clearly now about, for example, all the people who've been evacuated. There's over 29,000 people under evacuation orders in British Columbia. 19,000 people were evacuated from Yellowknife in the Northwest Territories, Hay River and other communities, and we are thinking about how we can assist and support those people as they return to their communities to make sure that power goes back on, cell service works, and they can resume normal life as soon as the threat of the wildfires passes.
The Premier of the Northwest Territories has said that her government, her territory, will need a lot of federal funding to help with some of that aftermath costs. Have the federal government committed any funding to that part of the process at this point?
Well, first of all, there are a number of provisions within the disaster financial assistance arrangement whereby the territories and the provinces can make application for federal funding to assist in the costs associated to some of the damage that's taken place, but also the firefighting efforts and the evacuations that took place. We will continue to work very closely with the territory to reimburse for all eligible expenses, but we also know that there are some extraordinary challenges in the Northwest Territories, and we're working very closely with their government and also with Indigenous governments in the region to make sure that the supports are there to help people recover. There's a great deal of trauma that's been experienced by that community, having to leave your home, having to flee with your most precious personal possessions, but uncertain as to whether your community would be there when you return. That's a very, very difficult thing for people to experience, and we want to make sure that we're there for those people as they're able to return to their communities so that we can get back to what hopefully will be as normal a life as we can help them achieve.
No specific funding commitment?
At the present time, those are discussions that are ongoing. A lot of the costs will be submitted to us for reimbursement based on eligible expenses in the disaster financial assistance arrangement, but there are ongoing discussions in a number of different ministries. We've all been tasked to work very closely with our provincial territorial partners, with regional governments and with First Nations to ensure that the support's there.
Given the amount of cash resources that have been put towards fighting wildfires this year, is there any more talk about having a FEMA of the North?
Well, first of all, I think it's important to understand sort of the context in which wildfire fighting takes place in Canada. The responsibility for that primarily, and they do it exceptionally well, is with the provinces and territories, with regional and local governments as well. And there are literally tens of thousands of volunteer firefighters and municipal firefighters who answer the call and do that work, and they work essentially for local municipalities and for the province. Our responsibility as the federal government has always been to work very closely in support of the provinces and territories. When they ask for additional assistance, we mobilize that assistance in whatever form it may take. It has taken, for example, the Canadian Armed Forces, but also the Canadian Red Cross and other civil service agencies that we provide support to. But we're learning from this experience as well. One of the things that we've heard very clearly from the provinces and territories is they need more firefighters trained. And so we have, through NRCan, provisioned a significant amount of money for both the training of 1,000 additional firefighters and also some of the equipment needs that they need. We'll continue to work closely with our provincial and territorial partners. One of the things that I think has been demonstrated over what has been an unprecedented and extraordinary fire season is the extraordinary level of collaboration and cooperation. The coordination that has taken place right across the country, from the fires that took place in Nova Scotia and in Quebec and Ontario, Saskatchewan, Alberta, and now British Columbia and the Northwest Territories, we've been able to move resources from provincial to regional and to territorial jurisdictions. They've been supplemented with the Canadian Armed Forces. We've even brought in international firefighters and international equipment in order to fight those fires. I think it's been exceptionally well done during an incredibly trying time, but we'll learn lessons from that, and we'll apply those lessons in ways in which we can make appropriate investments that are going to make it safer for everybody in the future.
Minister, JP Tasker, CBC News. The Prime Minister made it quite clear this morning where he stands on Meta and posting news on Facebook and Instagram right now during a time of crisis. Where do you stand on this? Do you think it's appropriate for these social media giants to withhold news in a time of crisis?
From my perspective, information is absolutely critical to keeping people safe. Getting timely alerts out and also providing with information to people about what's happening in their local municipality and giving them instructions on how to respond, where to go, how to continue to be safe. And the provision of that information, I think, is absolutely essential to the safety of all of our communities. And so it is deeply concerning that people are telling us that their normal source of information is not being made available to them this time. As a matter of fact, from CBC, I know that there's a low bandwidth CBC channel that's available in the Northwest Territories that is providing information, and we try to direct people to that as an alternative. But quite frankly, I think there is a responsibility for all of us, including those big web giants, to make sure that people have the information they need to be safe and to support their communities as well. Thank you all very much.
Thanks.
Êtes-vous d'accord que, selon le Premier ministre, que l'État est en train de mettre la vie des Canadiens en danger dans cette région-là du pays, en bloquant comme ça le contenu de l'État?
Bien, tout à fait. On voit que Facebook prend la décision de mettre ses intérêts commerciaux au-delà de la sécurité des gens dans des temps d'urgence, comme c'est le cas présentement au territoire du Nord-Ouest, que les gens ont besoin, c'est d'avoir de l'information de qualité, de l'information vérifiée pour avoir les bonnes indications puis être en sécurité. Et malheureusement, ils n'ont pas accès à ça présentement sur Facebook, alors que, je le rappelle, la loi n'est pas encore en vigueur. Elle a été votée, mais elle n'est pas encore appliquée. Et donc, il n'y a aucune bonne raison qui justifie ces actions-là par Facebook.
Les aménagements qui peuvent être faits dans le règlement pour convenir à Facebook, par exemple, dans des situations d'urgence, il n'y a pas de redevance?
Bien, il va y avoir une période de consultation sur la réglementation qui va commencer bientôt. Puis Facebook, comme toutes les autres plateformes, comme les médias d'information, comme la population générale, sont invités à commenter sur la réglementation avant l'entrée en vigueur de la loi. Donc, il y a encore une période pour eux de venir à la table, de dire ce qu'ils pensent et pour moi de les écouter.
Minister, on Facebook, can you just clarify, why is it that Facebook is in the wrong if clearly media companies that are going to the Competition Bureau over the fact that they can't access Facebook are suggesting that they do actually want access to Facebook as it is? So why shouldn't the government be back their own policy if they do want this news on Facebook?
Well, there's been, first of all, let me remind everyone that the law is not in effect right now. It has been voted, but it's not being applied right now. So there's going to be a consultation process around regulation. Facebook and Google and all the other media and the public are invited to comment on this regulation when it's going to come out. It's going to come out soon. And then we can hear about Facebook's problem with the legislation or with the regulation. But right now, there's no good reason for Facebook to ban Canadian news because the law is not being applied right now.
But that's not really a defense of your government's policy to say it's not in place yet. I mean, the point is that they oppose your policy that is coming in place. Justify this policy, you say, well, it's not in place yet.
Well, very often when there's legislation, there's opposition, but at the same time, the government is empowered to legislate. There has been a legislative process. Facebook was invited to give their opinion on the legislation, but I don't think that companies are above the government. So when we do vote a legislation, at some point, you know, companies do have to comply, and it's not in effect right now. It's going to be later. There's still a regulation process, so they're still invited to give us their comments. Thank you.
But they can remove services. They don't have to just keep giving services. They can decide not to, as they've done.
It's good. A familiar crew here. Look, I have no grand speech to kick things off with. I'm happy. I told a few of you I'd pop back over to answer some questions, so happy to pick up on whatever topics you guys would like to address.
Well, how should we expect a new national strategy from your government in the next months? Do you think it is needed?
So there's a number of different elements to what we want to do next. How we precisely frame it and whether that is a revisitation of the national housing strategy is something that I'm sure we're going to get into really interesting discussions on over the course of the next couple of days here in Charlottetown. But the things that I'm hearing are not so much about how we need to brand something, what we need to call the pocket of initiative. It's that we actually need to address the problems and anxieties that real people are living with. And I actually think we can, because as big as the problems may seem when you look across the system, the solutions that I'm hearing about from people who are living with housing need or people who are actually addressing housing needs already, they lay within communities in Canada. I'm hearing different opportunities about how we can better engage the private sector to invest in solving some of the housing challenges. I'm talking to employers who are actually interested in participating in workforce housing opportunities so they can help more quickly grow the economy. I'm talking to low-income families and the people who run non-market housing projects to make sure even the most vulnerable have a roof over their head. There's people who have dedicated their life's work to solving some of the challenges that we're now feeling in an unprecedented way. Whether we call it a revisited national housing strategy or whether we announce the measures, the people that I've spoken to want us to solve the problems and are less fussed about what we call the solution.
Says you're playing catch-up.
Sorry, could you say that?
You're playing catch-up.
It's fascinating for me. Look, when a person's in opposition, they're going to need to try to find some kind of a hook. I see him every couple of days shooting an angry Facebook video calling on the government to do something we campaigned on a couple of years ago and have since started to implement. You look at some of the solutions that he's pitching around building more housing around transit. Great idea. That's why we campaigned on it explicitly in the last federal election campaign, and you can look back to our platform and see that it's there. I've actually visited recently, when I was in Vancouver, a series of projects that have huge towers going up immediately adjacent to rapid transit solutions. When I was there, we announced a $500 million contribution to 9 different projects to the Rental Construction Financing Initiative. Every single one of the projects that we're funding is within about 800 meters to a kilometer of a walk of a rapid transit solution. This has been part of our strategy. Do we need to scale it up? In my view, yeah. We need to continue to get our money out the door more quickly to the projects that are already approved, which is one of the fastest things we can do to get more people housed and living in a community where they can actually access the services that they depend upon, get to the work that they depend upon to pay their paychecks. So certainly there are things that we need to do and need to do faster, but let's not pretend that we're playing behind the Conservatives who are finally starting to talk about the things that we've been campaigning on actively for the last couple of election cycles.
Your government got a report last week with, I think it was 10 specific recommendations of things the federal government can do. Some have described that as a bit of a task list for. Is that how you see it? Are you planning to implement most of what's on in those recommendations?
So I've had the opportunity to engage briefly with some of the co-authors of the report. It'll not be lost on you that some of them are actually going to be joining us to walk us through some of these solutions. Before we commit to saying, yes, these specific to-do items are going to be adopted wholesale by the federal government, I think we need to have a conversation with the report's authors, with the people who informed that report, and amongst one another, to determine how we can best prioritize the measures that are going to have the greatest impact as quickly as possible. In addition, I've been having conversations already with different people in the housing sector who are pitching solutions to us that may coincide with some of those recommendations included with the report and may actually fall outside of the narrow scope, I shouldn't say narrow, outside of the scope of what that fairly comprehensive report has actually recommended. So I've got to do my own exercise to make sure we're looking at the advice that comes from that report, which I think is immensely valuable, by the way. But I also need to engage with other players in the housing sector to make sure that we're leaving no stone unturned. This is a moment where I think Canadians realize that there are different voices at the table, but they do want the federal government to play a leadership role. When somebody sits down in my office, they don't want to see me tell them why it's another person's problem to fix. They want to understand how I'm going to help whichever level of government is involved in delivering a solution that's going to help them, help their family, and help their community. The report provides some excellent starting points, but it doesn't necessarily in and of itself get us there because we now have to figure out how to implement some of its recommendations in addition to other solutions that I think will have a meaningful impact for Canadian households.
More funding. More funding.
This morning, the Prime Minister talked about a shortage of construction workers and how immigration could help with that. Would your government be prioritizing immigrants?
So the short answer is yes. The questions that we need to continue to answer is exactly to which scale can we do that and how quickly. So it will not be lost on you that the job I had about a month ago was very relevant to the question that you're asking. One of the things that we changed while I was in the position of the Minister of Immigration, Refugees and Citizenship was actually to tailor the express entry programs to have dedicated draws for permanent residents who actually fall into one of 5 key categories. One of them was the skilled trades, and the reason that we wanted to adopt the skilled trades in particular was not just the overarching need for people with skilled trades, which is broader than housing, but specifically because of the need to unlock the economic opportunity when it comes to building more homes. This is both a social issue in terms of supporting low-income families who are outside of the housing market, but it's also a major issue not just for the construction workers who are going to put the homes up, but for the communities who will have the workers that they need if the homes are built. So yes is the answer. We're going to continue to tailor our programs. I've been thinking over the last number of weeks while I'm in this position of getting up to speed on a new file, but not being able to let go completely of the old one, figuring out what other solutions we may use to accelerate the arrival of the people who are going to build the homes. But this is not just an immigration question, by the way. It's a productivity question. We've got enormous opportunities if we embrace innovation in the sector. Going back to the question about the report you referenced a moment ago, the focus on innovation and adopting solutions like modular housing, where we can actually build at a lower cost per unit homes in factories that are of a comparable and sometimes better quality than homes that have historically been built in communities. I'm very lucky. I live about 5 minutes in my home constituency in Central Nova of a new industrial facility. My dad used to work there making rail cars a number of years ago before he became a teacher, and they're converting this 106-acre property into a modular housing factory and campus where they can do R&D, where they can do production. It's connected to rail, and they can get units out the back door on the tracks to any community in North America very, very quickly. These are the kinds of things that we need to be looking at, not just the hands that are going to build the homes, but the innovation policies we can adopt so the people building those homes can have a greater productive output. There's no easy solutions, but all of them are worth chasing, including using immigration.
When you were immigration minister last year, to 800,000, roughly 800,000 students came to Canada, international students. Many housing experts have said, including some you're going to hear from at this conference, they are really driving up rents in many cities. Is your government willing to cut the immigration levels when it comes to international students?
Look, thanks for this question, and indulge me for 30 seconds to give a bit of a preamble just so you can understand with a greater level of detail what my thinking is on this. So first, on immigration more broadly, we have to be really, really careful that we don't have a conversation that somehow blames newcomers for the housing challenges that have been several decades in the works in Canada. And I take people back not only to the early 90s, but starting slightly before, across Liberal and Conservative governments, where the federal government of the day repeatedly said, housing is not really what we want to be putting our attention on, and they retreated heavily from making the basic investments in social housing that is now revealing itself through the market today. And although we're starting to see a much broader range of challenges in market housing, not just in non-market housing, we are starting to see that some of them were the predictable outcome of a lack of investment for several decades. So generally speaking, let's look at what the actual cause of the challenges are that we're dealing with and recognize that immigration can actually be used as a tool to bring the workers that we need to build more homes, as I described in the answer to the last question. On the international student program in particular, I think we need to do some serious thinking here, and I made similar comments before. The reality is we've got temporary immigration programs that were never designed to see such explosive growth in such a short period of time. For the benefit of the audience, our temporary programs, whether it's for temporary workers, international students, or tourists, are driven by demand. There's not a set number every year the same way that we have for permanent residents. And although there's a large number of permanent residents that are now coming to Canada, half of those people in any given year may already be here. They're not putting additional pressure on the housing sector. The international student program has seen such growth and in such concentrated areas that it is really starting to put an unprecedented level of demand, in some instances on the job market, but given the economic conditions we've been living with for the past couple of years, you see it in a more pronounced way on the housing market. I think that we need to work very closely with institutions to make sure that they and different levels of government are playing a role to make sure if they're going to continue to bring in record numbers of students, that they are being part of the solution as well by making sure that they have a place to live. The other piece that I would mention to you is there's different ways that we can try to address this challenge. I have had the opportunity to engage with Minister Miller to discuss some of the potential options, but I think addressing some of the temporary residency challenges, which have seen extraordinary growth, in particular when you see stories about the exploitation of international students, with some institutions, if I can be completely candid, that I'm convinced have come to exist purely to profit off the backs of vulnerable international students, rather than provide a quality education to the future permanent residents and citizens of Canada. When you see some of these institutions that have 5-6 times as many students as enrolled as they have spaces for them in the building, and you see them continue to pop up in plaza colleges across the country, you got to start to ask yourself some pretty tough questions. And I should say, final comment, and I will come back to you for a follow-up, and I know this has been long-winded, not all private colleges should be treated with the same brush. There are good private institutions out there, and separating the wheat from the chaff is going to be a big focus of the work that I try to do with Minister Miller to identify a solution to this challenge.
So are you willing to put a cap then on the number of international students that Canada allows?
I think that's one of the options that we ought to consider, but I think we should start by trying to partner with institutions to understand what role they may play to reduce the pressure on the communities that they're operating within. But that's a conversation that is premature to arrive at a decision on, and we'll have more to say after I have the chance to engage with Minister Miller. Plus le monde pour améliorer, s'il vous plaît.
Est-ce que vous êtes prêt à mettre plus d'argent sur la table pour le logement, d'investir davantage que ce qui a déjà été fait?
OK. Immédiatement, il est très important pour comprendre. Il y a proche de 45 milliards de dollars maintenant dans le programme aujourd'hui. Pour moi, de faire des investissements partout dans notre pays pour construire beaucoup de logements. Selon moi, c'est essentiel pour assurer des Canadiens il y a confiance dans le programme. À commencer avec le programme qui existait aujourd'hui. Mais si le Canadien a besoin beaucoup des investissements pour fournir une solution pour des défis plus grands dans le secteur du logement, c'est possible pour considérer le prochain investissement. Mais immédiatement, je pense que j'ai une obligation pour commencer avec le programme qui existe aujourd'hui.
Avez-vous une solution concrète à proposer sur la crise du logement?
OK. Il n'y a pas une solution magique. J'ai besoin d'utiliser chaque outil dans le système pour encourager des municipalités pour changer les règles, pour encourager les provinces et des employeurs de faire des investissements pour soutenir des travailleurs, des personnes qui habitent nos communautés partout au Canada. Et c'est essentiel aussi pour moi de reconsidérer des programmes dans la juridiction fédérale pour comprendre des opportunités pour améliorer la productivité de notre économie. These are not easy solutions, but I think it's incumbent upon me to demonstrate that the federal government has a leadership role to play, and come hell or high water, we're going to play it.
Minister, I do have to go into it. Can I catch you up on this one? Just clarify on international students. Can you just clarify if there's a timeline? Are you going to be lowering the numbers this fall?
Look, I think Minister Miller will have something to say about that as the Minister of Immigration, but we'll follow up with you with the first weekend.
Okay.
But it's not even the weekend.
It's Monday.
Bonjour tout le monde. Comment ça va? Oui, je suis contente de vous voir. I hope you had a good summer. So let me speak first. I'm used to that. Okay? And then we'll answer questions. Okay, guys. Good to see you. So first and foremost, it's great to be here in PEI. Wonderful place with wonderful people. I'll have the chance to talk also with my colleagues and work on different issues, particularly making sure that life is more affordable and fighting the impact of inflation. You heard the Prime Minister. This is definitely our priority. We know also that when it comes to inflation, it is linked to what has happened in the world. There's been major geopolitical changes over the past months, and therefore, my job is to increase Canada's influence in the world, being there to find common solutions with our partners, maybe through strengthening our existing alliances or by forging new partnerships. And at the end of the day, we want to make sure that we are in solution mode at the international level. It's part of our foreign policy objectives. And finally, last point, I would like to also say that my thoughts are with the people that are affected by the wildfires in BC and the Northwest Territories. And I know the Prime Minister and the team are working with the people on the ground to make sure that we can support the people that are affected. Tu veux pas avoir mon speech en français? Ben oui, c'était tellement bon. OK, parfait. Donc, premièrement, il va de soi que je suis contente d'être ici à l'île du Prince-Édouard. C'est un endroit extraordinaire avec des gens extraordinaires également. J'ai bien hâte de pouvoir travailler avec mes collègues aussi sur des solutions qui sont liées à ce qu'on voit au pays et ce qu'on a entendu aussi partout à travers le pays. Les Canadiens sont préoccupés par les impacts du coût de la vie et certainement par les impacts de l'inflation.
Alors, notre priorité va être, au cours de la retraite du cabinet, de contrer l'inflation et de trouver des solutions. On sait aussi d'un point de vue international, l'inflation est liée à ce qui s'est passé dans parce qu'il y a eu des changements géopolitiques. Alors, dans les circonstances, nous, notre objectif, c'est de travailler avec plusieurs pays avec lesquels on est partenaires, avec lesquels on a des alliances pour trouver des solutions. Puis en même temps, on est là pour forger des nouveaux partenariats avec de nouveaux pays pour créer des opportunités pour les Canadiens et aussi trouver des solutions aux problèmes existants. Finalement, je tiens à dire que mes pensées sont avec ceux et celles qui sont affectés par les feux de forêt en Colombie-Britannique et également dans les territoires du Nord-Ouest, parce qu'il va de soi que la situation est difficile, alors on est là pour aider les gens affectés. Alors voilà, oui, je suis prête à répondre à vos questions.
Avez-vous l'impression que les Canadiens ont besoin d'avoir un plan clair de la part de votre gouvernement? C'est-à-dire d'avoir quelque chose de peut-être plus ambitieux ou du moins plus combatif que ce qu'ils ont vu jusqu'à maintenant? Les critiques, c'est que vous êtes un peu en rattrapage. Est-ce que vous pensez qu'il faut envoyer ce signal-là aux Canadiens cet automne ou au prochain budget ou autre?
Bien, je pense qu'on entend la frustration de la part de la population par rapport au coût de la vie parce que c'est vrai que ça coûte cher. Puis, on a été en mesure d'entendre plusieurs personnes partout à travers le pays cet été nous le dire. Et on en a fait déjà beaucoup pour contrer les impacts de l'inflation, mais on doit en faire plus. Et donc, c'est pour ça qu'on est en mode solution, on est proactif et on va être là aux côtés des Canadiens pour trouver des solutions avec eux.
Est-ce que Pierre Poilievre a raison quand il dit qu'il y a trop de bureaucratie pour bâtir davantage de maisons et de...
Vous savez, la question du logement, c'est mon collègue Sean Fraser qui va pouvoir répondre à cette question-là, mais certainement, notre objectif est encore et toujours de simplifier la vie des Canadiens et c'est pour ça qu'on va être en mode solution ici.
Pierre Poilievre dit que vous avez laissé cette crise-là pourrir, c'est-à-dire que vous l'avez laissé traîner et aujourd'hui, il dit, ben voilà, ils font un cabinet sur le logement alors que ça fait 2 ans qu'ils ont bousillé tout le truc. C'est à peu près ça son message aujourd'hui. Vous réfléchissez quoi à ça?
Pierre Poilievre est habitué de chialer, mais il n'est jamais en mode solution. Fait que la réalité, c'est que nous, on est là en tant que bon gouvernement compétent pour répondre à la préoccupation des Canadiens. On sait que les taux d'intérêt ont augmenté, on sait que le coût de la vie augmente, alors on va être là. On a toujours été là depuis 2015 avec l'allocation canadienne pour enfants. On était là à l'époque pour baisser les impôts de la classe moyenne. On était là à travers la pandémie et on va encore répondre présent.
Êtes-vous en train de penser sur le bon redémarrage de votre gouvernement durant cette retraite?
Vous savez, ce qu'on apprend maintenant partout à travers le monde, c'est que lorsqu'on gouverne, les choses vont vite et on doit s'adapter. Alors, on sait qu'on doit s'adapter à l'environnement qui est présent et c'est ce qu'on va faire.
Une question?
Nothing in English, just incredible, guys.
Not the housing and solutions,
Hi, Alex.
but last week you had a statement about a game plan for the U.S. takes a turn towards authoritarianism. I wonder if you could tell us a bit more about what Canada would do in that situation, what that game plan is.
Well, of course, we know that there will be elections in the U.S. next year, and of course, Canada will be ready, and we will be working with the administration that is elected by the American people, period. That being said, also, our government has experience dealing with administrations of both parties, and so that's why Canadians expect us as a competent government to be ready and working on many scenarios, and we'll do that.
Is there anything you're doing now in anticipation when you're talking about a game plan, or is there any, when it comes to foreign affairs or diversification, anything that you guys are doing now in preparation of what might happen in the next election?
Well, we will be, of course, working with premiers, we'll be working with mayors, we'll be working with the business community, unions across the country, because that's what Canadians know best. We know the U.S. best, and we will be there when the American people decide who to elect. Thank you. Yes.
Donc, si je réfléchis au rôle du monsieur Poilievre sur le logement, aucun.
Son pain, son beurre dans les derniers mois. Est-ce que vous avez pas une idée assez combative?
Non, ça. Monsieur Poilievre essaie de prendre le crédit sur des choses qu'il n'a absolument pas fait, de la même façon qu'il essaie de changer son image, hein? Mais le contenant, il est le même, là. C'est-à-dire qu'il change le contenant, mais le contenu, il est le même. Alors, il peut bien essayer de changer son image, mais c'est la même affaire.
Quoi la solution?
Moi, je dirais, il y a plusieurs solutions, c'est ce qu'on va parler en fin de semaine. Moi, je pense qu'on peut collaborer mieux entre les divers paliers de gouvernement, avec les provinces, avec les territoires. Sur la question des sous, on a mis beaucoup d'argent sur la table. Rappelez-vous qu'il y a 2 ans, on a fait un budget sur le logement. Alors, c'est une priorité absolue depuis des années, ça continue de l'être. Maintenant, est-ce qu'on peut mieux travailler? Moi, je pense que oui.
Experts say that you guys need to put up more money, though, that the context has changed with higher interest rates and inflation, that the money's not going as far as it did when you guys...
Well, these are things we're going to be discussing, because this is a priority, I would say, from the cabinet meeting. But I say, but there are things we can do already with the money that we have, because housing has been a priority for years. Remember, 2 years ago, we had a budget on housing.
But it's still a crisis.
It was a huge priority at the time, and it remains today. Now, can we put more money? Maybe that's what we're discussing. But can we work better with provinces? Probably yes.
What about helping Toronto fill its budget hole trend?
This show has been produced by Depictions Media. Please contact us at depictions.media for more information.